My name is Marianna Masiero. I am a researcher at University of Milan at the Department of Oncology and Hemato-Oncology. I am also a clinical psychologist at European Institute of Cancer. I am the work package leader for the work package 2, and several milestones have been achieved in this year. In particular, I would like to highlight the identification of behavioral and psychological risk factors that seem to be associated to the cancer onset. This milestone is particularly important for the iBeCHANGE project because will inform the design and the development of the ontology model of the iBeCHANGE platform. What is the ontology model? The ontology model, it means the content, the educational content, the intervention that will be created for people at risk of cancer, and also educational material that will be provided to the participants. And will permit us to identify the measure, in particular speaking about cancer prevention, the prompts that will be used for the assessment of the participants that will be enrolled in the clinical studies. And when I say the clinical study, I refer to the pilot study and the randomized control study that will be designed and implemented in order to test the efficacy of the iBeCHANGE platform to support behavioral change, that it means a good cancer prevention. Several challenges we have encountered reaching these particular goals. The main difficulties has been related to the identification of a good methodology for studying and for identify the variables that may affect cancer onset. Indeed, when we speak about the cancer onset, several factors may have an impact in the development of the disease, and often these factors are interrelated. We have a biological and physical factor, we have behavioral factor, and then we have also psychological factor. The most, I think that the most important challenge is to try to understand in which way each factor contributes to the cancer prevention. And then the second important challenge is related to the fact that we have to understand in which way we can measure this variable in order to have the possibility to identify a specific risk profile, because this factor often tend to combine between them and tend to define the risk of each subject. I think that the most important challenges are related to this, and also to try, the last but not the least, is I think that another important challenge is related to the identification of how we can measure using a wearable sensor or other device this type of behavioral and psychological value, because in this case we have to use a proxy of this variable, that it means to understand which type of wearable is able to detect in better way, that it means in terms of validity, this type of variable. If I think at the outcome of this work package, I think that in terms of cancer prevention have been collected some evidence to inform European citizens about which are the specific role of behavioral and psychological factor in defining the trajectory of cancer. This is in particular important because currently, as supported also by the European Commission, we have to try to develop a systematic approach to the cancer prevention based on the integration of behavioral and psychological factors. I think that the most important outcomes that may be extracted from this preliminary result may be used to start to inform by different channels citizens about how we have to intend cancer prevention using a more systematic and more holistic approach to the prevention, involving both behavioral factors related to the smoking, the diet, the alcohol consumption, but also relating to emotional well-being, and which are the problem related to the emotional well-being, not only anxiety and depression, but also, for example, the way in which people build the reality that seem to affect the emotional well-being, and thus having an impact when the construction is not positive, seem to affect the quality of life of the people, and then affect cancer and death. I think that the most important outcome that we have to take into account since this year of the project, in particular referring to the work package 2, is related to this point. We have collaborated, the work package 2 has collaborated with several other work packages. In particular, we have strictly worked with the work package 3, 4, and 5, that are work packages related to the creation of the technical model of the platform. Indeed, the result achieved in the work package 2 have informed the first preliminary design of the iBeCHANGE platform, and also the mobile application for the iBeCHANGE, and further result have informed the work package 5 that will start in the next months. That is, it is the work package related to the clinical studies that will be performed. Provide information about the type of measure that we have to use to monitor behavioral change, and the type of measure that we have to use to provide intervention to the people. Further, I would like to highlight that result in work package 2 have informed also the development of the point of the cares, that is the core of the iBeCHANGE platform. In particular, it has provided the inputs related to how we have to design the interfaces in order to be used by the healthcare providers, because we can develop tools for patients, we can develop tools for healthcare providers, but we have to develop tools for both categories that will be used. And the information the data that we have collected in the work package 2 may contribute to build the point of the care. So. The primary deliverable for the next year is related to the identification of the measure that will be used in the clinical studies. The first deliverable of the next year is related to this, and also related to the point of care. That it means to provide clear information on how this point of the care has to be designed, and which are the features that it has to contain in order to increase the possibility that will be used by the healthcare provider as tools to monitor population and improve prevention. Another important result that I think that we have achieved in the work package 2 that I would like to highlight after 1 year from the starting of this project is related to the contribution on the retrospective studies of the iBeCHANGE of the iBeCHANGE project. Indeed, as we have collaborated with the technical partner in order to evaluate retrospective data collection based on electronic patients' health record, collecting variables related to both behavioral and psychological aspects that may inform the creation of an algorithm able to identify patients at risk for breast, lung, and colorectal cancer. I think that in particular work package 2 and the clinical center involved in this work package have strongly worked closer to the technical partners in order to use retrospective data for informing the development of the algorithm able to provide information on the factor related to the cancer onset.